Welcome to another episode of Med Madness, your go-to podcast for all things USMLE. Today we're diving into a crucial topic in medical ethics, medical futility. This topic is essential for medical students and healthcare professionals because it directly impacts decision-making in patient care, especially when dealing with end-of-life situations and complex ethical dilemmas. Understanding medical futility helps you navigate the fine line between providing beneficial treatments and avoiding unnecessary interventions that could cause more harm than good. In this episode, we'll cover what constitutes medical futility, the ethical considerations surrounding futile treatments, how to address requests for futile treatments, the concept of no escalation of treatment NEOT orders, and a brief real-life case study to bring these concepts to life. Let's get started. Medical futility refers to treatments that offer no benefit to the patient and cannot achieve intended goals. This can be divided into two main types: physiologic futility and qualitative futility. Physiologic futility occurs when a treatment cannot improve a patient's physiological condition or achieve a physiological goal, including palliation or comfort. For example, administering cardiac catheterization to a patient with advanced cancer who sustained a large myocardial infarction and has an anoxic brain injury is physiologically futile because it won't alleviate the infarction, improve the brain injury, or enhance comfort. Qualitative futility is when the benefits of a treatment are minimal and are outweighed by significant pain and suffering. For instance, continuing aggressive treatment for a patient with severe septic shock and advanced dementia who is already on vasopressor support and has anuric renal failure offers marginal benefits and substantial suffering. From an ethical standpoint, physicians have no obligation to provide futile treatments because doing so goes against the principles of beneficence, benefiting the patient, and non-maleficence, not harming the patient. However, when a patient or their surrogate requests a futile treatment, it's important for physicians to understand their reasons, which may include distrust or overestimating the benefits. Physicians should empathetically explain why the treatment is futile. In contrast, high-risk treatments that offer some benefit, like cardiopulmonary resuscitation in certain patients without a terminal diagnosis, are not considered futile. Physicians should guide patients or surrogates in these scenarios, but cannot refuse the treatment if the patient or surrogate is informed and competent. No escalation of treatment, NEOT orders, set predetermined limits on treatment not to be exceeded, regardless of clinical deterioration. NEOT orders prevent futile care and help families process their loss, minimizing feelings of guilt. Case study. Imagine a patient with advanced dementia and septic shock deteriorating despite critical care measures, including vasopressor support. She now has anuric renal failure and signs of edematous lung injury, indicating a grave prognosis. Her family is reluctant to withdraw care, viewing it as giving up. The healthcare team discusses NEOT orders with the family, setting limits on further invasive treatments like hemodialysis or mechanical ventilation. This approach prevents futile interventions and allows the family to come to terms with the patient's condition, easing their feelings of guilt. To summarize, understanding medical futility and its ethical implications is crucial in making informed, compassionate decisions in patient care. Key points include recognizing when treatments are futile, understanding the ethical principles of beneficence and non-maleficence, and effectively communicating with patients and families about treatment options. We encourage you to engage with our pre- and post-podcast quizzes and use Anki flashcards to reinforce your learning. These tools are designed to enhance your understanding and retention of this important topic. Thank you for listening to Med Madness. Stay tuned for more episodes to help you ace your USMLE exams and become a compassionate, knowledgeable healthcare professional. Until next time, keep learning and stay motivated.